Hi, Andrea.
Hey.
You don't look like you're doing so hot today.
I am just over everything and everybody. And I don't want to be here.
I've seen that.
Sorry.
Well, what do you mean you're over everybody and everything?
It's been 2 years and the ex-boyfriend now is married and has a kid, and he sends me photos and I've asked him not to contact me and he still does. And I feel like it's a rub it in your face how great he's doing, and I'm still single and I can't get a job, and I was gonna move back in with my parents, but I don't wanna do that, and everything just sucks right now.
I hear that. It's a lot of things that suck. And in the past, I've touched in on sort of my mental checklist. So my mental checklist is about how's your sleep?
Oh, I'm not sleeping, I'm not eating. I can't tell you the last time I slept like through the night, and sometimes I'll nap during the day, but I can't sleep at night. My thoughts are, it's like, they just can't turn off.
Yeah. And tell me more about the thoughts that you're having.
I mean, I feel crazy. Like, and I know that's not a good word, but I'm like, I feel like I'm going insane. And I hate myself right now.
That's not a good place for you.
No.
So, part of my checklist is suicidal thoughts.
I don't want to be here. I don't want to be anywhere.
And plan?
Yeah.
Tell me what your plan is.
Well, I had bought some sleeping pills because I told my doctor that I wasn't sleeping, and he gave me like 60 Ambien. So I figured that would just be like really easy to do.
And if you were to take them, when would you be taking them?
Probably like within the next few days. Because I'm just like, I just can't do this anymore.
I hear that. There's that hopelessness and that sense of I can't even go on.
I can't.
And so, Andrea, I need you to know that there are some steps that we need to take, given that you have some suicidal thoughts and a plan, and not just a plan, but you started acting on that plan, like getting the medication, and you know how many it is, so you asked for it, and you've even said in the next couple of days. So because of that, what we've talked about, this work is confidential, but I need to break confidentiality. So what that means is this, that because you're at this kind of place, you meet the criteria for hospitalization.
I'm not going to the hospital.
And most people don't want to go to the hospital. It's really a
But
tough
I feel
place
like
to
right
be.
now you're telling me that I am crazy, because that's where crazy people go, is the hospital.
Well, and what I would want us to do is reframe it, because I know that it seems like crazy people go to the hospital. You just actually said it feels like you're in a crazy place. And so what I'm trying to kind of move us toward is that the hospital is going to be helpful to stabilize and to keep you safe, because I'm not hearing that you can keep yourself safe.
I really don't think so.
I hear that. So we have two choices, that you go voluntarily, or I ask somebody to evaluate you, and that means that you would be hospitalized against your will.
What does that mean?
It means that we would actually need to wait for somebody to come in and evaluate, or we need to get you to an ER. What that means is that they would probably put you in handcuffs and put you in the back of a police car and take you to the hospital for an evaluation there.
But why do I have to go in handcuffs?
Because that's the procedure that the police use.
So what happens if I decide to go by voluntarily?
If you go voluntarily, then what I would ask you to do is to get yourself to the hospital and let me know that you have arrived, and let me know you can actually, I would want to talk to somebody about what my observations are, as well as the report that you might have. And we'll talk about what the key points would be for you to tell whoever it is that would be evaluating you at the hospital. So what would you like to do?
It kind of sounds like I'm going either way.
Kinda.
And I don't want to go in handcuffs.
I wouldn't want that either. That's sort of an extra level of stress and trauma that you might have.
So I guess I'll go by myself.
Okay, so what we'll do then is, I want you to check in, and I want you to, let me know that you, got there, and I really wanna know what's decided too. So either you can let me know that, or you can ask the evaluator too.
How long do you think I'll be there?
It depends on your insurance. So some people are there for a couple of days. The max these days is probably 5 to 7, sometimes 10. It just depends on how, and what will happen is that you'll be put on some medication to get you sort of your mood stabilized. And as soon as your mood has stabilized, then they'll release you. And then what I would want is for us to meet right away so that we could figure out where we're going from here.
Will you still see me afterwards?
Absolutely, yes.
So that won't affect our
Yep.
relationship?
No, it won't.